to say what are the candidate Ebola vaccines that could be given emergency use authorization or that could be tested in Uganda?
Thanks, Gabriela. At the moment, we are looking at data first before we can be able to mention with all the data and the discussions internally. As soon as we have something concrete to share with the public, we'll be able to do that. But we are in discussion with at least one advanced product, and we are looking at that data if it is possible to take it to the next stage. If the data is good, we'll do that. If the data is not good, then we'll ask for them to go back and generate more data.
All right, we come back to you, Paul.
Yes, thank you very much. And so my first question has to do with the Ebola situation in Uganda. In your briefing, you mentioned that previously available test kits are not picking this, and which means testing only has to be done using the PCR. So my first question is, can you give us an idea of the available capabilities to conduct?
And so it's an issue of getting the reagents, and any PCR platform will then be able to do this testing. So what we are focused on right now is getting the reagents to where it is needed. And so far, that has worked out quite well. Neighbors are tracking. As I said at the beginning of this brief, I've had discussions with the neighbors of Uganda, and we are in constant touch so that we ensure that each country is prepared in an appropriate way. We do not want to see any leakage beyond the immediate area where the virus has been identified. Escalation to other countries, if they need to, we will do that. They have some capacity right now, the neighboring countries, and we are increasing that capacity. Part of the reason we've been discussing this with them quickly at the point of identification. So that capacity is there. It needs to be increased, but that will be done based on need. Right now, the need is more in Uganda, and we are building that capacity for testing by availing more test kits. And this neighboring countries, we are raised the alert levels, and so they have some modest levels of capacity. And if needed, then we'll scale it up. We don't want to have capacity that is laying idle. But COVID pandemic really drove up PCR platform capability on the continent, and this we are going to use, including for Ebola virus disease as well.
All right, thank you. Our final question today is coming from Sarah Jerving, who's with DEVEX. She says, how long could it take before there is a more rapid test for the Sudan strain?
Thanks, Sarah. Very those outbreaks we've seen over the last, both in DRC and Uganda, the Sudan strain has only shown its face maybe maximum of 3 times. So it's not a very common virus that causes an outbreak. But part of our new public health order is local manufacturing. And then seeing that it has popped its head again, we are going to work with manufacturers to see that we develop some good quality rapid tests that we can be able to deploy to the community. But at the moment, I can't tell you how long that is going to take. This is going to be something purely with a production at the institutional level. Those institutions that are involved in producing the rapid test kits. I can't give you a timeline at the moment.
All right, I think we have enough time. We've just had a question coming in, so I think we can quickly squeeze it into today's program. And the question is coming from Lucia Blanco from the International Spanish News Agency. What does it mean exactly that a vaccine candidate will be given emergency use authorization by the Africa? Soon can that status be given to a vaccine?
No, thanks, Lucia. Point of ours is to provide the information that is required and advocate for this to happen as soon as possible. When we see the data that is coming out of the trials that any particular vaccine candidate may have. At the moment, we don't have that, and that is why we are saying we are looking at the data to see if we can go and make a request for emergency use authorization. At the moment, it is not Africa CDC that is going to be doing that. It is WHO that has the mandate for that authorization.
All right, thank you very much. That was our last question for today. But before we close, maybe you might like to just highlight a few pointers that are of critical importance.
Yes, indeed, Wayne, and three things. One is the Ebola situation in Uganda is being managed very effectively by the government of Uganda, and working with them over the last several weeks when this has been announced. We see the commitment that they have, and so we are working with the neighboring countries to ensure that rumors and misinformation does not get into the way of this particular vaccine for this strain of Ebola, the Sudan strain. And so we are focusing this initial phase of response to community engagement, and then managing those who are found to be positive. This is what is going to give us the best results in the absence of an approved vaccine. And then finally is that COVID-19 is still here. We still need to push to get as close to 70% as possible. We are doing that as Africa CDC by working with governments on the continent to do mass vaccination as we design how to transition into a more routine availability of COVID-19 vaccines through the routine immunization programs. So we are doing both accessing the vaccines, supplying the vaccines, that is, and then working with governments to get those out into the public. We would like to reach 70% or be as close to 70% as is possible. So the pandemic on the continent is still not over because we have low vaccination rates, and we would like to get as close as possible to 70%. These are the three things that I would add, Wayne, as messages for today.
Thank you very much, Ahmed, for an informative briefing today. And thank you to all colleagues who have joined us online. And also a big thank you to colleagues within the African Union and Africa CDC for facilitating this broadcast. Let us all meet again next week on Thursday at the same time, which now.